Good afternoon, and thank you everyone for tuning in to our media briefing this afternoon. And as usual, I'd like to welcome Dr. Elizabeth Richardson and our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director, who will be providing some comments in a moment. But as you may have heard, Hamilton will be entering the gray lockdown category of this province's COVID-19 response framework beginning on Monday, December the 21st at 12:01 a.m. Sunday night, just after midnight. This is a very serious situation, and as a result of entering the lockdown, we're going to see a number of restrictions in our community. Some of the highlights of these restrictions include no indoor organized public events or social gatherings except for members of the same household. Individuals who live alone, including seniors, may consider having exclusive close contact with another household to help reduce the negative impact of social isolation. And a maximum of 10 people can gather together for outdoor organized public events or social gatherings. There will be no indoor or outdoor dining. There will be only takeout, drive-through, and delivery options in Hamilton. Retail will be open for curbside pickup or delivery only. In-person retail shopping is generally not permitted, with some exceptions for essentials like supermarkets, hardware stores, pharmacies, and other essentials. Paul's going to talk about some other restrictions we can expect as we enter lockdown on Monday, but at this point, we all know the public health advice, but please do your part to follow it. Limit your activity outside the home to essential activities only. Wear your mask, wash your hands, keep your distance, and if you have any COVID-19 related symptoms or are not feeling well, stay isolated at home and get tested for COVID-19 as soon as you can. So Hamilton, please do your part. Sadly, we're in a different category now, which I'm sure is not a terrible surprise to many, but with the increasing numbers, it is, I think, the right thing for the province to do. So I'm going to pass it on now to Paul Johnson, our Emergency Operations hardworking Director, to provide us with some updates from the EOC. Paul?
Thank you, Mr. Mayor. And yes, there are a number of changes that will take effect as a result of moving into the furthest category in terms of restrictions, or the harshest category in terms of restrictions. And some of those have to do with municipal services, so I wanted to touch on those for just a minute. Before I do that, I do know that many people will also be following media reports and even the comments of the Premier that additional measures may be coming in the future. And just to remind folks that what we're announcing today does follow all of the restrictions that are already published by the province for gray and lockdown. Any future things will be announced by the province, and we would adjust as we go forward, but stick to what is there in writing, and the provincial website provides all of the details for it. But I'm going to highlight a few things, in particular some of the impacts it has on our municipal services. So with this move to the gray lockdown category, it means the closure of all of our municipal museums and the closure of our greenhouses at Gage Park. It means that we are going to close our municipal service centers and City Hall to walk-ins. Appointments will be required for in-person transactions, and you can make those appointments by calling us at 905-546-CITY or 905-546-2489, if those are all the digits. We're also encouraging people, though, to keep that to a very limited amount, only if you really feel that you can't do these services online. Many of our services, in fact, the vast majority of what those who call Hamilton home would need to access are available online or over the phone, and we would encourage you to do that. Marriage ceremonies at City Hall are unavailable now, but the marriage licenses are available by that appointment piece. So we will not be doing any of the ceremonies at City Hall any further, but certainly if people need marriage licenses, they can book an appointment and do some of that as well. The Provincial Offences Administration Office is closed to walk-ins. Appointments are necessary for those as well. Animal Services, the service counter is going to be closed to walk-ins. And again, appointments are required for those in-person transactions. And the licensing service counter at 77 James Street North, which we had opened, is now going to be closed to walk-ins, and appointments are necessary there. So you get the rhythm of this. It's going to require appointments, so while we're in this gray zone, for you to come and do any in-person transactions with the municipality. Some of the biggest impact for us as a municipality is also around recreation. Our recreation facilities will be closed, and all of those activities will be canceled. Some of our outdoor activities will have to be modified, and we'll provide some more details in the early part of the week in terms of outdoor activities, which are still allowed to continue. So some outdoor recreation facilities can continue to provide service, but they are greater restricted, as you heard the mayor talk about, in terms of outdoors to 10 persons. So we will be adjusting accordingly. So this is really a very significant pulling back of the access to programs and services in the community. And I've talked about it from a municipal perspective, but recognize that many of those extend into the private or not-for-profit sectors as well, in terms of some of the recreation activities that are there or other services that people may be providing. And it is very important that our business community and our not-for-profit community go to the provincial website and understand what it means to move into this gray lockdown zone and be prepared for Monday to conform accordingly. There's simply no way that the mayor and myself and Dr. Richardson can go through every single one of those eventualities here. People need to do that work. We do have a link that will be on our website to the gray area so that people can start to prepare. And as of Monday, our website will be updated with all of the restrictions that are required in this new category. So over the weekend, we remain in the red control category, moving to gray Monday at 12:01. So this is, again, in response to what's going on in our community. And like the mayor, I'd encourage everybody to take heed of these further restrictions and recognize now that certain activities that were advice in the past are now covered under the Reopening Ontario Act and under the orders and the enforcement that we will have as a community. Our enforcement task force through bylaw has been preparing for this and are ready when they start in the on Monday to be enforcing to the gray zone orders. So people need to be prepared for that. And there are many restrictions that need to change in terms of people's thinking as you go out, and also in our personal lives. It is now not recommended you stay in your household. It is actually a rule. And so that can be enforced. And so I think the subtle messaging here and not so subtle messaging is a lot of the things that we were hoping people would take naturally are now part of what is required under this provincial category. With that, I'll turn things over to Dr. Richardson, and we'll take us through some of the epidemiology that got us to this position and clarify some more of the things from a public health perspective.
Thanks very much, Paul. And as you noted, we have now reached the level where we do have to move into gray. And I'll give you the epidemiology behind that. So we're now at 4,653 cases. Fortunately, 77% of those are resolved, but we now stand at 877 active cases for Hamilton today. We have a total of 26 local outbreaks that are up on our website. One new outbreak was reported today, and that's at St. Peter's Hospital. Our weekly rate of new cases per 100,000 population is now at 116. So we're nearly 3 times the threshold that took us into red. So very concerning in terms of the degree of spread that is happening in Hamilton. And again, the reasons behind it remain the same. This is largely due to people not following the advice that Paul just talked about, which has now become rules in terms of socialization, people going out, and as well issues that are happening at some of our workplaces. And so, as you know, I did put in additional restrictions around active screening in workplaces as well as in any retail locations, and both of those will remain in place when those essential businesses continue going forward. Our average number of cases, our 7-day moving average is at 98, and our percent positivity amongst tests is sitting in the 4% range. So that's very well into the high range and is of concern. As always, there are more details on our website around the local activity. So it is not, of course, only the case numbers that have led to us coming into gray. It is also other things that are taken into consideration, and that includes the impacts on our healthcare system and the impacts on our public health system. So right now, our hospitals are over capacity and are overwhelmed. They have expressed their concern, as you've heard in previous days, and are continuing to have challenges as we go forward. The outbreaks in our congregate care facilities are growing. Unfortunately, several of those have been difficult to bring fully under control. health human resources, not just public health human resources, but overall health human resources are very tight. That means nurses, PSWs, physicians, all of the staff, the environmental staff that help to care for people in long-term care homes, in hospitals, they are pushed to their limits in terms of being able to provide care in congregate setting sites and elsewhere. Every day, of course, our case counts have continued to rise, our rate per 100,000 population per week in particular. And as well for our public health staff, we are now at a point where we are finding it very difficult to keep up with case management and with contact tracing, and that's despite well over 120 additional staff having been hired and having significant support from the province and from the federal government in order to do this work. So unfortunately, we have continued to see transmission at a higher level in our community, and we are needing to move forward with further restrictions in order to look at bringing transmission down. So in addition to those framework restrictions, again, re-emphasizing that trips outside of the home should only be for essential reasons, for work, for school, to get groceries or visit the pharmacy, for healthcare, or to assist those who are vulnerable with the needs that they have, and for exercise or physical activity. Virtual gatherings or events are the safest way to visit or recognize occasions with people outside your household. We recognize absolutely that as we're coming through this holiday season, this is a particularly difficult time to be doing this, but this is also a particularly important time to make sure we are following the rules. Unfortunately, we've continued to hear of people holding holiday gatherings, despite the fact that these have not been recommended, and we have definitely seen transmission that have been linked to these. Reminding again that people should be working remotely wherever possible. So really encouraging organizations to look at how they might further implement work from home if they've not done so already, and ensure that people are able to do that. As well, to make sure that a face mask or a face covering is worn when around others from another household. So if you are having anybody who has to come into your home, whether it is a healthcare worker or a single person who is coming to your home because they don't have others that they can join with, then please ensure that masks are used in those circumstances and stay physically distant as much as possible. Washing your hands remains a key piece, and as well, very important, if you have any symptoms that are related to COVID-19 or are not feeling well, please stay at home and isolate and get tested for COVID-19. As well, if you've been told by an individual that they are COVID-19 positive and you have been in contact with them, please stay at home, self-isolate, and only go out to seek a test. Mr. Mayor, I'll turn it back to you.
Thank you, Doctor, and thank you, Paul, for that additional information. Of course, the lion's share of that information is on the website. That's available to you, and certainly the regulations around the gray zone are also there, so you can prepare yourselves. And we need to reinforce that we're almost back to where we started back in February, March, and April, where we were virtually in complete lockdown, and we're at that again virtually. If not in reality, and with higher case numbers than we had then. So the rationale for doing that certainly is as strong, if not stronger, than when we did that earlier on in this pandemic. We need to save lives here, and people are dying daily. The numbers are well higher than they were earlier on a few months ago, and the outbreaks are continuing. So we've got to protect our most vulnerable. No one should be prepared to sacrifice our seniors and anyone else that's most vulnerable with underlying health conditions. And we have to protect our economy and our retail businesses as much as we possibly can. So I know that some folks are not going to be happy about this, as I'm not, and I think most of us are not pleased to be where we are, but it's the reality of the pandemic that we're in the middle of, and we have to get this under control. So thank you for continuing your good work, and we will hope that you will take Christmas in stride. It's going to be different. It is an opportunity to reset. If we all follow the rules, we may very well do a great job of reducing the cases and allow us to get to a different place. But for now, we are going to follow the province's advice and lock down and do the best we can to avoid the spread of this virus. So thank you all for continuing on with that work. And Jasmine, I'm going to turn it over to you now for some media questions, and then we'll get back to wrapping things up. And then a reminder as well that we'll do another media advisory on Monday, given that there may be additional potential recommendations coming out from the province at that point. So we'll do an update then as well. Jasmine?
Great, thank you, Mr. Mayor. We'll start with one question and one follow-up for everybody. First question to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi there. I hope you can hear me okay. I wanted to ask Dr. Richardson, you mentioned difficulty bringing outbreaks in long-term care under control. And I wanted to ask from an infection control perspective, what has public health found in terms of how the situation's escalated so quickly, especially where in Grace Villa's case, for example, even though more staff was deployed, even that additional staff started to get sick?
Thanks, Maria. And it did cut out just a little bit there, so I hope I'm getting the nuances, but if I'm missing anything, please just clarify for me. So in terms of the outbreaks that we've had, as I talked about, our health human resources have been very, very tight. And what we've found, particularly in the case of Grace Villa or Shalom Village, is that they have experienced that tight level of health human resources. And with the introduction of COVID-19 into the facility, they're unable to ramp up a level of staffing to the next level that really is required whenever you have this kind of outbreak in a facility. So when you look at the degree of PPE that needs to be used, when you look at the restrictions, the cohorting of staff to residents, when you look at the monitoring that needs to go on to make sure all of that is used. And then of course you have residents who are now sick and are requiring additional levels of care. And so as I mentioned in the past, we're hearing from some of our homes, they really need to double, if not triple, the level of staffing that is available when they go into an outbreak mode. And so if they don't have those staff available to them and aren't able to get them from their usual sources, our congregate settings table is coming together looking to support these homes with the staff that they can, and where it's required, we go further with orders, whether they're a 22 order to ensure that good infection control practices are in place, or a 29.2 order in order to ask another organization to come in, usually one of the two hospitals, to come in and support the facility in managing that outbreak.
Thank you. And to follow up, do you have any concerns over any, like either Grace Villa or Shalom Village or any of the other long-term care homes in terms of their the building structure or air quality that could have contributed to the spread?
Thanks, Maria. At this point, I've not heard from our staff concerns in that regard. Certainly, it is important. We do know that some of the older homes in terms of their physical plant, but that's more around the arrangement of space and the closeness of residents within that space has been a concern. But we are, we know that that's an issue in terms of the Ministry of Long-Term Care and what they're looking at in terms of renewing their sites, the physical plant overall, and I'm sure that's something they'll pay attention to as well.
Great, thanks, Dr. Richardson. Next question will be to, looks like he's gone. Looks like Matt Ingram is gone. We'll go next to Dan Takama from CBC Hamilton. Dan, you can go ahead.
Hey there, this will be Dr. Richardson again, likely. You mentioned hospitals and occupancy and just kind of being overwhelmed there. I want to take you back to that. If you can talk a little bit about the situation that's facing the hospitals and just how kind of critical that is.
Absolutely, Dan. As you know, they have been trying very hard to catch up on some of the cases the surgical cases in particular that were missed over the spring with the first lockdown that they were under. And so they've been operating at the highest capacity that they can in order to make that up. At the same time, as we've now seen an increase in the number of COVID patients that are in those hospitals, they're having to dedicate more staff to those similar sorts of IPAC procedures and cohorting and things that we're talking about in long-term care. as well. They have had to support the congregate settings that we've just been talking about, the long-term care homes and retirement homes in the community. And they are unfortunately also experiencing their own outbreaks. We've had both St. Joseph's Hospital and Juravinski most recently have outbreaks within the hospital. So they are under a lot of stress in terms of their services and their capacity. And they are very concerned about where they sit going forward. We do run a number of regional programs for our neighboring areas as a tertiary care center. And so they are trying hard to maintain and preserve those services while they are continuing to provide care in the community.
Okay, thanks. And this one might be a little bit more difficult to answer, but it feels like we've kind of been here before, except this time we're actually going into lockdown. There were a couple of weeks there where it was really a question that was top of mind for folks if it was going to happen. And we saw kind of rising numbers. And I think you and the mayor and Paul have all spoken to how kind of critical the situation is, how remarkable these numbers are, and not in a good way. So I'm trying to think of the way to phrase the question, but is this too late to enter lockdown? Do you think it's come in a timely way, or should this have happened weeks ago?
I don't argue with the province's work on this. You know, they've had Toronto, Peel, and Mississauga in lockdown for quite some time. You know, the numbers have been increasing. You know, they've been reasonably consistent in terms of following the science. And so I'm not here to second guess all of that. We actually did, you know, think that the red zone with the enhancements, we were hopeful that that would have some, you know, additional impact in terms of reducing the numbers, but it hasn't seemed to be borne out. And so I don't think it left the province too many options other than decide to be consistent with other lockdowns that they've done in the province. And I would think that possibly on Monday we may be able to see some additional recommendations that they may come up with to help curb the spread of this virus even more throughout the province. Don't know that yet, but certainly you know, we might anticipate some additional recommendations to come down the pipe on Monday.
Great, thank you, Mr. Mayor. Next question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My first question is for Paul. So I just want to be totally clear on this, because this lockdown is going to come into effect before Christmas. So people, if they gather with someone outside of their household who is not a single person living alone, who's exclusively seeing them, what is the fine that they could face?
Oh, in terms of the actual fine amount, I'll have to stall and bring that up, because there's a series of fines, but there are fines under, I think it might be the 880, but let me get clarification in terms of what it is. But it is a significant fine, and would be commensurate with what we've been seeing in terms of gatherings that are over the limit now. The reality is, though, heading into this lockdown period, you can't gather. But I'll confirm the actual dollar amount with you. I might be able to do it even by the end of the time here.
Okay, thanks very much. And then my next question is for the mayor. The province has acknowledged that lockdowns don't work in a sense. I mean, you look at the regions that have been locked down and their numbers are still going up. Does the province need to add more measures to slow the spread in places like Hamilton?
So you know, I can only, you know, imagine what would have happened if Toronto hadn't locked down. I think, you know, we'll never know that number, but the reality is it could have been much worse had they not taken some significant steps to try and curb the spread. So I would say for Hamilton, you know, I think for the urbanized area, the Golden Horseshoe, for this province, I would say there may very well need to be additional measures that, you know, as indicated by you, that, you know, Toronto, Peel, Mississauga, you know, they really haven't come plummeting down, that additional measures might be needed, and possibly you know, over the Christmas holiday break may be an opportune time to actually put that into effect. So in some respects, the Christmas break for certainly a lot of municipalities and potentially schools might be the window that, with maybe some additional time, that might allow for us to kind of break the cycle of this virus spread. So I'm not here to predict what the province might do, but there may be an opportunity here over the holidays to do something more that might have a better impact in terms of reducing the spread of this virus.
Thank you, Mr. Mayor. We'll go next to Jeff Mahoney from the Hamilton Spectator. Jeff, you can go ahead.
Sorry. Yeah, I don't really have I'm here in a kind of backup capacity. I missed the very beginning of the meeting, so I apologize. Is the lockdown taking effect immediately? I'm sorry to make you repeat yourselves, but
yeah, the lockdown's taking effect Monday morning, 12:01 a.m.
Okay.
or
Thanks.
Just after midnight Sunday.
I'll forego my questions. I'll sort of give them to my colleagues at the Spectator already there. Thanks very much.
Thank you.
Great, thanks. So that's the end of our media questions. I'll just go back quickly to Paul if you know yet. Otherwise, we can follow up with Katrina afterwards.
I think it's important to follow up because there are different fines for organizers of the event. And so in this case, it could be fines that are also to the people who invited those who are over. And we've seen that happen before. So if you're the organizer of the event, it's different than if you're an attendee. So we'll just clarify the actual numbers. They are large fines. They're not insignificant. And so they can be levied and will be levied. And I think I'll close with the message of, again, this is not, well, we'll disinvite some people, but still have some over. This is no one outside of your household, unless you are providing that obvious support to a single person, particularly those who may need or at risk of their own personal health deteriorating because of isolation. But single persons can choose, again, one family to be, or family grouping to be a part of. This also isn't a chance to wander around to a variety of places if you're on your own. This is about supporting those who are on their own through this period, but not extending this to crazy levels. And then the second piece is you can't invite people into your home. It's now, it will result in a fine and a charge if you do so.
Great, thanks, Paul. Mr. Mayor, that's the end of our media questions for today. I'll pass things back to you.
Okay, thank you, and thanks to the media for dialing in on short notice. Obviously, we are all moving fairly quickly to keep everyone informed. So thanks for spreading the word, and thank you for the good efforts of Bill Custers and their entire team at Cable 14 and Clear Cable for reserving some time for us so that we can get this message out as well. And lastly, I'd ask, and I know this is going to be hard, but don't rush to the stores. The whole idea behind all of this is to prevent crowds of people gathering together that encourages the spread of this virus. So to go rushing to the store right now, use those online resources as much as humanly possible. You want to support your local stores. I get that. Most of them, if not all of them, have online resources. They can arrange for delivery. I'm sure many of them can still arrange for delivery before Christmas. So please use those resources as much as humanly possible so that we can avoid the ongoing mall crush that should not happen this year at all, and isn't really necessary in the next couple of days, given where we are in this pandemic. So please do your best to stay home, go out for the essentials only, and look after one another. The website is hamilton.ca/coronavirus. All the information on the gray zone is there, as well as all the supports for businesses and individuals in our community. And we know there's hurt and harm to be had here, but there is an enormous amount of financial supports out there that can be tapped into to help you get through. And remember also that on Monday, this coming Monday, we'll be back here at 4 p.m. with either a reinforcement of the message that we're sharing right now, or potentially additional information that might be shared by the province at that point in time. So in the meantime, take care of yourselves. Be aware that Sunday night, just after midnight or early Monday morning AM, these gray lockdown zone will be in effect. And I ask you to do your part to adhere to the measures that are inherent in the gray zone, and keep ourselves and our citizens, fellow citizens safe. And again, the best Christmas gift you can give to anyone right now is to not help or participate in the spread of this virus. Thank you, and we'll talk to you on Monday.